Impetigo is a highly contagious bacterial skin infection that primarily affects young children but can occur in people of any age. It's characterized by sores and blisters that can spread easily to other people. The infection is usually caused by two types of bacteria, Staphylococcus aureus staph and Streptococcus pyogenes strep. Symptoms: Impetigo typically presents with the following symptoms: sores and blisters. Initial lesions, small red bumps or blisters, often appearing on the face, especially around the nose and mouth, but can occur on other parts of the body. Sores, the blisters break open, leaving behind red, raw areas. These can ooze and form a honey-colored crust. Itching and discomfort. The affected areas may be itchy and uncomfortable. Swollen lymph nodes. Swelling of the lymph nodes near the infection site may occur. Fever. In some cases, especially in more severe infections, a low-grade fever may be present. Types of impetigo: non-bullous impetigo. Most common type, characterized by small, red spots that turn into blisters, then break open and form a yellowish-brown crust. Bullous impetigo. Less common type, characterized by larger blisters filled with fluid that eventually burst and form a yellow crust. This type is more often seen in younger children. Ecthyma. A deeper form of impetigo where sores become deeper and more severe, leading to ulcers that can cause scarring. Causes and risk factors: bacterial infection. The infection is caused by staph or strep bacteria, which can enter through cuts, insect bites, or other breaks in the skin. Risk factors. Young children. More common in children due to close contact in settings like schools and daycare. Poor hygiene. Lack of proper hand washing and personal hygiene can increase risk. Crowded environments. Living in crowded conditions can facilitate the spread of infection. Skin conditions. Existing skin conditions like eczema or insect bites can increase susceptibility. Weakened immune system. Individuals with weakened immune systems are at higher risk. Diagnosis of impetigo is typically based on medical history and physical examination. Healthcare provider will examine the source and assess the appearance and location of the infection. Laboratory tests. Swab test. The sample of fluid or pus from the sore may be taken and tested to identify the bacteria causing the infection. Culture and sensitivity. Tests to determine the specific bacteria and the most effective antibiotics for treatment. Treatment for impetigo usually involves topical antibiotics. Mupirocin Bacteriban, a common topical antibiotic applied directly to the infected areas. Redipamulin, another topical antibiotic option for treating impetigo. Oral antibiotics. For severe cases, if the infection is widespread or not responding to topical treatments, oral antibiotics such as dicloxacillin, cefalexin, or erythromycin may be prescribed. Wound care. Cleaning sores. Gently wash the affected areas with soap and water and keep them clean and dry. Avoiding scratching. Prevent scratching or picking at sores to avoid further spread or complications. Preventive measures. Good hygiene. Regular hand washing with soap and water. Avoiding sharing personal items. Do not share towels, bedding, or clothing. Covering sores. Keep infected areas covered with a clean bandage to prevent spreading the infection to others. Complications: if left untreated, impetigo can lead to complications such as cellulitis, a deeper bacterial infection of the skin and underlying tissues. Abscesses, pockets of pus that can form under the skin. Post-streptococcal glomerulonephritis, the rare complication affecting the kidneys, typically following the strep infection. Prognosis: with appropriate treatment, impetigo generally resolves within a few weeks. Adhering to prescribed treatments and preventive measures can help ensure a swift recovery and minimize the risk of complications. Conclusion: impetigo is a common and contagious skin infection that can be effectively treated with antibiotics and proper wound care. If you suspect that your child or someone else has impetigo, Consult with a healthcare provider for an accurate diagnosis and appropriate treatment. Ensuring good hygiene and following treatment recommendations can help manage the infection and prevent its spread.